So bring this out. I'm going to have you lift this arm up as high as you can go. Okay, so that gets stuck right there. How long's that been catching up on you?
Oh, I think it's probably about a couple of years now since the injury.
Okay, go ahead and let that relax. And you're a pretty avid weightlifter.
I am. A minimum 3 times a week is where I have to find my steady pace of contentment.
Okay, so how's that shoulder injury since 2014 been affecting your...
It has limited my ability to lift in certain exercises, and because of the popping motion, I tend to be very cautious in military presses, over the head presses, that type of thing.
Okay, so let's test this now. So you're sticking right here because that's your body. At this point, your body wants to just curl up like this and pretend it never happened. So those restrictions are not structural. I know it feels like it to you, but it's your brain locking that down on purpose. I always tell patients this is the structural version of anaphylactic shock, where your body would rather kill you than eat shrimp. Okay. No intelligence behind that decision, but that's just how we react. Sure. Kind of the same thing here. Your body would rather shut this whole thing down than deal with it. So we're going to force the brain to deal with it. Hold right there and push straight up towards the ceiling. So that's your middle deltoid. There's no strength there at all.
Wow.
Now that's not something you can lift for the rest of your life. That's not coming back because your brain's not tuned in.
Okay.
Yeah, I mean this shoulder after 3 years, it's just in such a pattern of just being protected that it doesn't even remember what to do anymore. Now that's a little better.
Okay.
Which is funny, everyone wants to blame every shoulder problem on the rotator cuff, and ironically that's what's working with you. So that one's better, but still takes a little effort to get it up there. The problem is when something gets shut down neurologically on one side, there's always some spillover into the other side.
Got it.
Hold right there. So basically what we're seeing with the shoulder, there's a thing in the neurology called reciprocal inhibition. It's a fancy word that basically says when I flex my bicep, my tricep turns off. Because I can't move my elbow in both ways at once. So if I'm moving it this way, this muscle has to turn off.
Sure.
And it's that reciprocal inhibition that just, works for us when it's working, works against us when it's not.
Absolutely.
So let's get this fixed. Good. Wow, that's a lot stronger. Notice a little difference there?
Oh, yeah.
Bend your elbow. Right now, I'm going to bring your arm here and lift that up as high as you can. Good. That's what it's supposed to do.
Wow. So that is the after effect of the actual procedure.
Yeah. Yep. That's once we turn the brain on, you get instant function back. You said that's been kind of stuck there since 2014.
Yeah, it's complete mobility restored to the point where it almost feels as if there's been a major, like something has let loose, and I have now this mobility restored. That's really incredible.
Yeah, we just took your brain out of protective mode. Now your brain doesn't want to curl up in the fetal position. It wants to go to the gym and lift weights.
Yeah, that's exactly what I've been looking for. It's that's incredible, Dr. Kingsbury. I've never given chiropractors the accolades they deserve until now. What an incredible,
I appreciate that. That's a great compliment.
Procedure you brought to my attention. I'm amazed now at things that I'm able to do after one session.
Yeah, you'll see the strength balance almost immediately pop back.
Okay.
Yep. I mean, you're going to have to do a little work on it.
Sure, absolutely.